Welcome to our walkthrough of Medicare changes going into 2026. Each year, Medicare updates its premiums, deductibles, and drug coverage rules, and these shifts can directly affect your healthcare and your budget. In this presentation, we'll break down what's new for 2026, helping you understand how these changes might impact your financial planning and medical decisions. Our goal is to give you clear, reliable information so you can make informed choices with confidence. Remember, this is for educational purposes only, but by staying informed, you'll be better prepared for what's ahead. Let's look at the key Medicare changes for 2026. For Part B, the monthly premium will increase to $206.50 and the annual deductible will rise to $288. Part D, which covers prescriptions, has a projected base premium of $38.99 a month, a deductible cap rising to $615, and an out-of-pocket limit set at $2,100. Meanwhile, Medicare Advantage plans Part C will see a slight decrease in maximum out-of-pocket limits and will introduce new AI-assisted prior authorization pilots. With nearly 65 million Americans impacted by these updates, understanding them now helps you prepare financially and make confident decisions during open enrollment. Focusing on Medicare Part B, the monthly premium is set to rise to $206.50, up from $185 last year. The annual deductible will also increase, moving from $257 to $288. These premium hikes could absorb nearly 40% of the 2026 Social Security cost of living adjustment for many beneficiaries. If your income is higher, you may see additional charges through IRMA surcharges, ranging from $14.50 to $91 each month, based on your modified adjusted gross income from your 2024 tax return. It's important to be aware of these increases so you can plan for their impact on your monthly budget. Turning to Medicare Part D prescription drug coverage, the average base premium is projected at $38.99 per month, a 6% increase from last year. The deductible cap will rise to $615, while the annual out-of-pocket limit is set at $2,100. These figures represent the maximum amounts allowed. Some plans may offer lower premiums or deductibles, but cannot exceed these caps. Importantly, the out-of-pocket limit continues protections introduced by the Inflation Reduction Act, offering significant relief for those with high medication costs. Understanding these caps can help you compare plans and anticipate your drug expenses. Let's take a closer look at the new cost protections and program improvements coming to Medicare Part D in 2026. One of the most reassuring updates is that all recommended adult vaccines, such as shingles, pneumonia, and flu shots, will be fully covered at no cost to you. This means you can stay protected without worrying about extra expenses. For those who rely on insulin, there's continued good news. The monthly cost for all covered insulin products remains capped at just $35, and you won't have to pay a deductible for these medications. Another major improvement is the introduction of the first wave of negotiated drug prices, which are projected to reduce costs by an average of 38% for select medications. This can make a real difference for those managing chronic conditions. Additionally, a new prescription payment plan will allow you to automatically spread high drug costs across the year in manageable monthly installments, easing the financial burden and helping you plan your budget with greater confidence and peace of mind. Let's talk about some important changes coming to Medicare Advantage, also known as Part C. In 2026, the maximum out-of-pocket limit for these plans will decrease slightly, about $100 lower than before. This means you'll have a bit more financial protection against unexpected medical costs. Remember, while the exact amount can vary by plan, no Advantage plan can exceed the federal maximum. New features are also rolling out. Select states will pilot AI-assisted prior authorization to streamline approvals. Telehealth coverage is expanding, and you'll see improved dental, vision, and hearing benefits. Plus, transparency rules for provider networks are being strengthened to help you make better choices. Beyond the core plan updates, 2026 brings 3 additional programs designed to make Medicare more manageable and transparent. First, the prescription payment plan lets you spread high medication costs across the year with manageable monthly payments. There's auto-enrollment, no interest charges, and less financial strain from large bills. Second, new transparency rules require insurers to provide clearer benefit explanations and easier-to-use drug pricing tools, helping you compare your options confidently. And third, the drug price negotiation program launches with 10 high-cost medications, aiming for an average savings of 38% and adding more drugs each year. These updates work together to lower costs and simplify decision-making. Let's quickly recap the major Medicare changes for 2026. For Part B, the monthly premium rises to $206.50 and the deductible increases to $288 per year, with higher IRMA surcharges for some. In Part D prescription coverage, the deductible cap moves up to $615 and premiums average around $39 per month. But there's a new out-of-pocket maximum of $2,100 plus free vaccines and a $35 insulin cap. Medicare Advantage plans will feature slightly lower maximum out-of-pocket limits, new authorization programs, and expanded supplemental benefits. Altogether, these changes aim to strengthen cost protections while keeping your healthcare coverage reliable. So, what steps should you take in response to these updates? First, mark your calendar for open enrollment from October 15th through December 7th. This is your yearly chance to review and switch plans as your needs change. Next, compare Original Medicare with Advantage options to see which best fits your budget and healthcare needs. Don't forget to evaluate your Part D drug plan closely. Review formularies and networks to ensure affordable access to your medications. Plan ahead for higher costs and possible IRMA surcharges. Tax planning can sometimes help manage those. And finally, be sure to take full advantage of cost protections like free vaccines, the insulin cap, and new payment plans. In summary, while Medicare costs are rising in 2026, important protections are also getting stronger. The best way to navigate these changes is by staying informed and taking action. Review your current coverage, compare all available options during open enrollment, plan ahead for premium increases and potential surcharges, and make use of every new benefit or program available. By understanding what's changing now, you can make smart decisions that protect both your health and your finances in the year ahead. If you need help understanding your options or want personalized guidance, don't hesitate to reach out for support. For additional resources or answers to your questions about retirement planning, not just Medicare, simply scan the QR code on your screen or visit akersretirement.com. You'll find clear strategies designed to support your long-term financial well-being. Please note that this presentation is purely educational. I do not sell Medicare plans. If you'd like to discuss your unique situation or need guidance on next steps, feel free to reach out at any time. Our goal is to empower you with reliable information so you can make confident decisions about your future.